Okay, welcome back. This is Dr. Jin Sung and Dr. Jin Sung Show. Today is Tuesday at 12:30. And again, we want to deliver high quality content for you. And it's been about 6 months since we started this program of delivering quality information. So we've talked about a lot of different conditions, anything from diabetes to Hashimoto's thyroiditis to autoimmune disease. So we never really talked about what we do in this office. How are we different from any other office here in the Northeast, right? Or in the United States for that matter. Okay? My practice is in Massachusetts. And when patients come to our office, they've already seen the best doctors here in Massachusetts, right? This is the home of the best hospitals, Mass General, Brigham and Women, you name it. All the best specialists are here, right? So why do they come to this office? Is it because we know more than their specialists? No, we don't. They come here because we have a different approach. We have a different approach to all the different ailments that they are suffering from, right? So if they go to one specialist, to another, and to another, they don't have a lot of options after that. Because in the traditional medical model, they have two options, right? One is a proper diagnosis and a medication that comes along with it. So you have a medication for a diagnosis. And your other option is probably surgery, right? So the best hospitals here in Massachusetts are fantastic at those two things, prescribing the right medication and surgery. But when you come in with a patient who's got chronic fatigue, right, they have all these symptoms, yet their blood work doesn't dictate a diagnosis. What did they do? There's not much, right? They often shuffle them to another specialist or shuffle them to another neuropsych eval, because oftentimes they say it's in their head, right? So what makes our office uniquely qualified to help those individuals who've been to all the different specialists here in Massachusetts? Well, it's the approach. How do we approach a patient? The first thing that we do in this office is really look at the patient as a whole. We do an in-depth consultation, 75 minutes, right? Your first consultation is 75 minutes. Right? When's the last time you went to your doctor and they spent 75 minutes discovering all the nitty-gritty history about you, right? Trying to figure out the underlying causes for all your ailments. It doesn't happen in the traditional medical model or Western medical model. You don't get the time that you need to discover what's going on with your health. In our office, it starts with the consultation. The consultation is a discovery process, an in-depth consultation. After the consultation, what we do is we run labs. Labs that probably were not run properly for you in the past, or alternative labs that look at other things other than, is my blood count normal, right? It looks at stool analysis, it looks at adrenal panels, it looks at mold toxicity, Lyme disease. So we're kind of going deep to look at the underlying cause. What is causing your ailments, right? Once you can find those triggers, these things that impact our lives, then you can start to heal, right? So in our office, we have a few different priorities that we like to address with every single patient that walks in the door. Now, it's not a cookie cutter, you do this, and this for everybody, right? But we do have some priorities that we need to handle so the patient can heal. So number one, and it's no in particular order, it's the different priorities that we handle in the office, right? So if someone comes in and they have anemia that was never diagnosed, that needs to be handled. Anemia basically causes lack of oxygen to your tissues. So if you don't have enough oxygen, your body will have the inability to heal, right? So anemia or fuel delivery or oxygenation, right, needs to be managed so your body can heal, right? Number 2, gut restoration, right? If you have a poor GI tract, poor digestion, you have parasites, right? You have inflammation. Those things will impact your health globally. So in the functional medicine model, we talk about things like leaky gut syndrome or intestinal permeability, right? This is really not a diagnosable thing, right? It is a state that your body is in where things that should not cross the gut barrier is starting to cross over. And it causes low-grade inflammation, which eventually goes to the brain, and it starts to create brain fog, right? So we think about gut function, and we also think about brain function, because they're intimately connected. And your traditional, conventional doctors don't think about it that way. So if you go to a neurologist, they only focus on the brain. If you go on to a gastroenterologist, they're only focused on your GI tract, right? But there is a connection there. And if you have brain fog, sometimes if you just take care of the leaky gut issue or digestive issues, then the brain fog can lift, right? So number 1, anemia. Number 2, gut restoration. Number 3, we talk about liver function or detoxification, right? Liver is not the only detox organ, but liver is a big part of the detoxification. So you have to be able to detox out things in your body, toxins, overloads, medications, whatever it is. It has to be able to detox out of our system so our body can be healthy. So that needs to be addressed. And usually that liver detoxification is a nutrient-dense detoxification. So we try to give you all the nutrients that are necessary for the detoxification of phase 1, phase 2, and phase 3 detoxification. Okay? On top of that, what we like to look at is metabolism of sugar. Are you hypoglycemic? Do you have insulin resistance? Do you have diabetes? Right? Are you overweight? We look at those things because that also impacts fuel delivery. You need oxygen and you need glucose or proper fuel. In order to get the proper fuel, you have to be eating the correct foods. Eating the correct foods also helps to heal the leaky gut, right? Or intestinal permeability. Those steps need to be taken in order for the body to heal. It preps the body for the healing process. Because the body has a remarkable healing mechanism, right? It's innate, your body's innate ability to heal, given the right circumstances. But sometimes people don't realize they are in a poor situation with stress outside of their home, right? With work, or spouse, or children, or they're not getting enough sleep. And then they work in a factory that works with chemicals and smells and so forth. All these things will impact the health. So our job in this office is to look at the underlying causes and fix those underlying causes. Fix those underlying causes so that the body has the ability to heal, right? And it takes time. You know, there is no easy way to recover your health. If you're looking for a 1 visit, you know, or 2 visits, and then I'm perfectly back to my optimal health, that's not going to happen. Most patients who come to our office have been sick for, 5 years, 6 years, 10 years. And they have been mismanaged. And they are just going down into this kind of spiral, right, of despair. And what we need to do is start with foundational things. So we look at anemia, gut restoration, liver function, sugar metabolism, right? And are we even getting enough fats? Because fats are very important for nerve function, right? Fat is necessary for cellular function. So proper essential fatty acids are necessary. So we look at things more in a holistic, global effect that we can, if we just change a few things, can have a global effect in terms of health recovery. So it's very, very important to look at the function of the body, not just compartmentalize your condition. So if you have diabetes, it's just the pancreas and you have a blood sugar problem and that's it. It could be an autoimmune disease. You don't know. So in our clinic, what we're trying to do is discover the underlying causes. We use specialized testing to figure that out, an in-depth consultation to figure out what the underlying triggers might be, and run the proper testing. It's so crucial to run the proper testing. We fuse functional medicine, we fuse functional neurology, right, and good old common sense to figure out what's going on with the patient and try to discover what ails the patient and try to help them just kind of get the foundations in place so the body can heal. All right? So I would like for you to write down this phone number. Number is 978-688-6999. Your first step to health is calling our office and setting up an appointment. Right? That is your first step. Because most times people are hesitant to come into our office because they've already been to so many other doctors. They've been to specialist after specialist after specialist. So they're very hesitant. They get skeptical. You know, what can Dr. Sung offer that's different from anybody else I've seen? You know, I've already seen the best of the best. What I can tell you is you will get the most tenacious doctor, I would say, right? Who will look for the underlying causes and look to help you fix the foundational things so you can recover from your health ailments. And that's what we do in this office. We look for the underlying cause and we stay persistent. It's hard work on your part, but at the end of the day, it's all worth it, right? Because without your health, you do not have your freedom. Without your health, you cannot have the freedom to do the things that you want. It doesn't matter how much money you have. If you don't have your health, you don't have your freedom, right? Essentially, that's what it is. So you have to recover your health so you have your freedom to do the things that you want in life, okay? So I'd like you to take this opportunity, call the office and make an appointment because this is your first step, right? Your first baby step to recover from all the different health issues that you have, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results. We'll see you next week.